Hello, Dr. Pallavi. I'm Satish. I have invited you to my show that it's STEMRX Beyond Hopes, and today we are going to discuss about the topic premature ovarian failure. So, at the start of the session, I would like to ask you the question that actually what is premature ovarian failure?
Yeah, so premature ovarian failure is the condition when ovaries stop working even before the 40 years of age. That means the ovary don't have any follicles and they are unable to generate any hormones that are required for regenerative function, reproductive function.
Okay.
Then we call it as a premature ovarian failure.
Then what will be the causes for this condition?
There are so many causes for the premature ovarian failure, like chromosomal condition, certain toxins, chemotherapy. If a patient is going through any ovarian carcinoma-like condition, if he is taking any chemotherapy, then also the premature condition, ovarian failure-like condition happen. And certain toxins, as I said, certain chemotoxins, certain pesticides or preservative also leads to the premature ovarian failure. And certain surgeries on the ovary when the endometriosis like condition is there and you are going to do the surgery, it will also reduce the ovarian reserve. So all these reasons, and one of the most important reason is the immunity. If our own body immune mechanism is going to hamper the cells inside our body, that is also called as autoimmunity, it also leads to the premature ovarian failure.
So, how we come to know that somebody is facing this kind of problem?
Yeah. Sometimes patient present with the irregular menses. Sometimes they may present like a menopausal condition, dryness in the vagina, or a hot flushish like condition, decreased sexual drive like condition. If somebody is trying to getting conceived, but all these conditions may lead to the infertility as well. So all these conditions, you can say these are the symptoms of premature ovarian failure.
And the means combined question, you can say that what will be the complications in this condition?
Yeah, there are so many complications because of this hormonal deficiency, and the follicles are not present in the ovaries. Obviously, it is leading to the infertility. This is the one of the complication you can say. And further, there is a estrogen deficiency which may lead to the condition like cardiovascular diseases, also lead to the osteoporosis, also dementia may be there because it is very stressful condition. It also going to harm your nervous system. There is also condition called as Parkinson disease, which also get aggregate in premature ovarian failure because of estrogen deficiency.
So the topic infertility is not new to the world. It is from years and years we are facing this problem. Now after the science goes ahead and we can find that what will be the problem, and we come to this problem that is premature ovarian failure is the one condition with that infertility may cause. But what will be the treatment for this?
Yeah, so treatment may vary. If patient wants fertility, so their options will be different, and if patient wants to come out of the menopausal condition, then the options will be different. But when we talk about the infertility like problem, the options are so less. Even we are living in this 21st century, even though the normal IVF center don't have any option apart from the donor oocytes, because even though in premature ovarian failure you have very less quantity of oocyte in the ovaries, but sometimes this ovarian quality is also not that much great, so they will always give you the option of donor oocyte. Then to prevent the menopausal condition, you can take the hormonal supplements like estrogen therapy. But in the long run, you cannot take this therapy for long duration because there are certain limitations for that. There are certain side effects of this hormone as well. It may lead to the endometrial hyperplasia like condition. Sometimes the endometrial carcinoma may be one of the reasons for estrogen therapy. Breast carcinoma like condition also happen because of estrogen therapy. So there are certain limitations in the conventional medicine, but the regenerative medicine now coming hope for the patient, you can say. So
we are going to discuss about this, about the regenerative medicines we are going to discuss, but Before that, I want to ask you that how you diagnose or decide that this kind of this infertility is because of premature ovarian failure.
Yeah, so whenever the patient present to us with these conditions, with these symptoms, we rule out all the his history. Sometimes family history also there, that mother is suffering from the premature ovarian failure, or sister is suffering from the premature ovarian failure. Sometimes patient give this history as well. So we need to take detailed history of the patient. Detailed examination should be done. Apart from this, some hormonal test we used to do because. Menstrual irregularity may happen because of various number of reasons.
Yeah.
Like hyperthyroidism may be there. There may be hyperprolactinemia, which may cause the irregular menses. Sometimes diabetes also cause the irregular menses. Obesity also may lead to the irregular menses. So you need to rule out all these conditions by doing hormonal examination. Apart from that, you must have to do the patient's AMH. AMH is very necessary thing to take out how much ovarian reserve is present in that patient. So this is one of the most important tests. Apart from that, the ultrasound will give you the clear picture, how many follicles are present inside the ovary. So this, I can say, these two tests are very much important and very much helpful for ruling out this condition.
As we are working with Stemarex, and Stemarex is known for regenerative medicine treatment.
Yeah.
And now also you suggested that the treatment is there with the help of regenerative
medicine. This is
medicine.
A promising one actually.
Yeah, but I want to know that what is actually regenerative medicines.
Regenerative medicine is mainly consists of the cellular therapy.
Yeah.
So in cellular therapy, you can say we are going to use the mesenchymal stem cells in that condition. We are going to use PRPs in that condition because they are very much rich in growth factors, peptides. So all these come inside the regenerative medicine. Apart from that, we are going to use the recent biotechnologies, bioengineering in this field to increase the patient's circulation. We are going to use the quantum energy to increase the circulation to that area. Then lymphatic drainage through that area, detoxification of the body. All these are the part of regenerative medicine.
So how the treatment will done with regenerative medicine? So
the regenerative medicine, as I say, the main hero is the stem cells, you can say, because stem cell has very good quality of you can say regenerative, reparative, multiplying itself in the different kind of cells is one of the best quality in the stem cells. Apart from this, they have anti-apoptotic property. So they are going to prevent the damaged cell to going to death of the cell should be prevented. That role is played by the stem cell. They have anti-inflammatory property. If your body has certain inflammation, they are going to treat with the stem cells. So whenever patient come to us, we rule out all the history of the patient, do the detailed examination, the hormonal studies, ultrasound, everything is going to do. After that, we take out the bone marrow from the, you can say directly from various bone sites are there, from which we are going to take out the bone marrow, adipose tissue from there, and we are going to segregate these cells inside our lab. So the segregation of mesenchymal stem cell will be there. Then we do fortification of these cells, culturing of these cells, and along with that growth factors and peptide, we re-inject these cells inside the body of patient. So they are going to help you in the different ways.
Means regenerative medicines means your own cells are going to help you.
Yeah.
Yeah. So as our show is named as Stemarex Beyond Hopes, so can we give the hope to the patients or the affected peoples that with the help of regenerative medicines, the premature ovarian failure can be cured?
Yeah, definitely we can give them hope because stem cell have capacity to divide into the follicular cells as well, germ-like cells as well. Yeah. That we are currently doing so many cases and getting so good responses in them. So there is a last hope which patient can have, that they can have their own baby of their biological origin.
Okay, so with this hope, we will end today's session, but we'll definitely meet with a new topic for the new session. Thank you, Dr. Pallavi.